Hi, Dr. Parikh. My name is Alex, working with Dr. Flynn, and we're really excited to have you at IFRU this year. Wanted to start off by asking you a few questions. So, how do you expect the landscape of sexual medicine to evolve over the next decade? And specifically, which emerging areas of clinical research and investigation do you believe will be the most vital for advancing sexual medicine?
Yeah, so I think sexual medicine is really entering an era that's increasingly personalized, multidisciplinary, and really focused on overall health rather than isolated symptoms. So over the next decade, I think we'll see a shift from treating sexual medicine as a standalone condition to really understanding how it's integrated into different manifestations of cardiovascular, metabolic, neurologic, hormonal, and psychosocial health. So several areas of research that I think will be particularly important are different regenerative and restorative therapies, including stem cell-based approaches, tissue engineering. I think we're going to have pretty rigorous validation before adoption, obviously, but I think those could be very interesting areas. Machine learning is going to be even bigger than it is now, so hopefully we'll have different AI algorithms to help us substratify patients and help with different treatment modalities from that standpoint. I think it's going to lead more into precision medicine, so using different genetic, molecular, biomarker-driven approaches to see which patient is going to benefit from specific diseases and really transition men's health from being a standalone issue to a systemic marker.
Next question is, what critical aspect of sexual health do you think is most commonly overlooked?
Yeah, I really think, and in my fellowship training with Dr. Kara and Dr. Lipschultz, this was really emphasized, but something I tried to integrate into my practice is, again, looking at sexual health as kind of a relational context and looking at it also from a psychological perspective. It's not just that patient's concern, but sexual dysfunction is really a couple's disease. So addressing it from that standpoint, I think, is really important. So historically, sexual medicine has focused heavily on physiology and treatment modalities, which are, obviously important, but focusing on the couple, the relationship satisfaction, communication, mental health roles, stress, anxiety, body image, different cultural issues equally play significant roles in this disease process. So focusing on it in terms of a relationship status or a couple's disease rather than a luxury concern, I think is really important.
Excluding your residency and fellowship training, what are a few things you've learned through your years of clinical practice that you believe all future urologists and trainees should know?
What I personally think is important in my clinic is that often listening to the patients and just letting them talk is more important than prescribing or finding an immediate treatment option. So listening really matters. Many patients who seek our help for sexual health concerns have been reluctant to seek care for years, and taking the time to understand their goals, their needs, their expectations often has as much impact as the treatment itself. Second, anytime I see a patient in clinic with sexual dysfunction, kind of tying back to what we talked about earlier, I always order a broader hormonal profile, contact their primary care physician, because it really is a window into broader medical health issues. So cardiovascular disease, the number of guys I've diagnosed with diabetes just from coming into my clinic is outstanding. Depression, hormonal abnormalities, relationship challenges, medication side effects. So really honing down into the key details. And then third, I would say setting realistic expectations is really crucial. Successful outcomes depend not only on choosing the right intervention, but also making sure that the patients understand what the treatments can and cannot do. And a lot of my talk at IFRU, especially on Peyronie's disease, is that exactly, figuring out, you don't want to oversell and underdeliver, but you want a functionally acceptable outcome from the patient. So managing those expectations often really determines that relationship and patient satisfaction more than the treatment itself. And then lastly, it's a lifelong learning process. You've got to be humble. Medicine will keep you humble. So keep learning, keep up to date on the new evidence. I think that's really important.